Hello, so my name is Jessica Fernandez, and today I'm going to be speaking about the biopsychosocial analysis regarding smoking. Smoking behaviors still possess a significant health risk. Although smoking is in a recess in Western societies with higher incomes, contradictory effects in poorer parts of the world lead to over or increasing numbers of smokers. So, contemporary psychologists approach research, diagnosis, and treatments of mental disorders from a holistic point of view by using the biopsychosocial model. The health-related behavior of smoking is dismantled using the biopsychosocial model, and an explanation about the consequences of the failing to examine the behavior from all these three perspectives of the biopsychosocial model is given, which is pretty much the biological, the psychological, and the social perspective. So here you can see how it's breaking down and some of the aspects from the biology, from the psychology, and the social are related in between this type of disease, which is more considered as a health situation that might come in every human being life, society, depending on their life. So in biology, we have pathology, we have diseases, symptoms, science, treatments, doctors, tests. Part of the cycle is the depression, the stress, the anxiety that can bring to the smoking situation, and as well as the social, which are hobbies, the family, the isolation, and money problems, friends, career, etc. We also have cultural influences. Over the year, television shows and films have effectively built up associations between smoking and glamour, sex, and risk-taking. From the classic movies, the cultural images involving cigarettes are strong and generally positive about smoking. There is a consistent evidence that links exposure to depictions of smoking and movies and initiation of smoking in young people. The tobacco industry denies targeting young people, but the result of the product placement in TVs and film, as well as sponsoring exciting, risky market sports, and that it attracts the attention of young people. Layer per layer, you might find a different perspective of broader explanations about human behavior along the long lifespan development. Therefore, human behavior is multicausal, multidimensional, and multifactorial. It would not work and would not meet the requirements necessarily in order to assess, diagnose, and treat an individual who suffers from a health-related behavior. To understand such a complex behavior like smoking, one needs to disassemble it by using the biopsychosocial model like the following. From a biological perspective, the biological cause for the addiction of smoking lies within the drug itself. Tobacco is containing about 4,000 ingredients. The main substance, nicotine, is with a very high probability responsible for the extreme addiction that comes with smoking. For a non-smoker, the rate of the composition takes 120 minutes. For a strong smoker, it takes only 30 minutes. So that being said, if the substance is not consumed, then severe deprivation symptoms like a low frustration level, aggressive anxiety, depressive mood, concentration problems, and insomnia arise that leads to the addicted smoker to the next cigarette. So nicotine stimulates reward circuits, particularly in the midbrain. The MHBAPN pathways has been proposed as critical crossroad that influences the brain response to nicotine. For its enrichment in nicotinic acetylcholine receptor, it takes part in several reward-related circuits, designating the MHBAPN as a convergent track for cholinergic, serotoninergic, and dopaminergic signals. Nicotine tightens blood vessels and increases blood pressure, initially increasing the alertness. So, antenatal nicotine exposure has been linked to heightened vascular hypertensive responsivity and oxidative stress. Together with childhood nicotine exposure from passive smoking that contribute to the later etiology of FP. So, with enduring nicotine addiction, withdrawal symptoms take the lead in maintaining the SB. The nicotine withdrawal it produces increases salivary corticols levels, initially shortens simple reactions time, and enhances sustained attention. Mild stimulation of lung tissues might exhibit placating effects on nervous individuals by mediating mental activity, but they are usually attributed to withdrawal symptoms once tolerance has been formed. Therefore, tasks with high demand for sustained attention forward a persistent SB. A family anapsia is indicated to identify relative with nicotine or other dependencies, as genetic components have been identified in nicotine acetylcholine receptor subunits that relate to general addictive behaviors. From a psychological perspective, the smoker himself realizes as a consequence of the nicotine intake a feeling of relaxation and power, an increase of concentration and memory, leverage of pain and hunger, and even some which from changes in their social environment, like easier contact with people, stress and aggression mastering. Those psychological factors tied in within the physiology of a smoker and will subsequently lead to addiction. Some factors that we need to take in consideration when it comes to the psychological is to explain smoking from the behavior point of view means to look at two foundational principles of learning: classical and operant conditioning. Nobody's born as a smoker, right? So behavioral smoking is learned during the course of life. For example, if smoking after dinner produces a feeling of relaxation, then dinner produces a response, right? Then more often these responses are paired, the stronger they will be, and the behavior is reinforced by stimulus-response reaction. Now, both forms of conditioning lead to the addiction of smoking, where nicotine is the addictive substance. Then you have the cognitive processes are also responsible for the stimulus response genes that are the expectation of the favorable effects of the smoking and extreme anxiety in the case of smoking cessation. The rational emotive therapy found by Ellis helps untie the knot of expectancies by the way of the Socratic dialogue. Many people who easily quit in the Western societies likely have already done so, and those who continue to smoke find quitting difficult. The most promising effect results from a combination of bupropion, nicotine replacement, and cognitive behavioral therapy. These treatments even have proven to be effectively applied by primary care physicians with considerable abstinence rates on follow-ups. Education about the effects of smoking is an important starting point on the way. The same goes as looking at from a social perspective. Since human behavior doesn't take place in vacuum, social influences like modeling, peer pressure, and family members who smoke are also part of the whole picture. The social perspective is as much important as other two approaches are, because assessment and treatment might not work if that factor is left behind. Smoking is usually started upon social reasoning. Social ideas that display have been identified as a primary driver. Secondhand smoke exposure at home mediates the association between parental smoking and student smoking, posing a substantial risk towards the SB in children. So in group cultures, feeling of belongings encourages. Advertising promotes ideals of subculture and products. Movie smoking has been established as a precursor. However, its predictive effects on blacks was reported to be lower than whites and Hispanics, suggesting cultural effects. Well-known thinkers, for example, Sacerdote Paget, are remembered smoking pipes, given a smoking and exculpating intellectual flair. Cigars are still used to display their entrepreneurship. Tobacco appears as an important economic factor. Meritocracies tolerate self-exploitation, promote risk-taking behavior, and further discourage the thus be as a valid coping strategy. Group culture overemphasizes ritual and ignores the consequences. So, pretty much other studies, some other authors have investigated policy and effects on male and female groups. Increasing prices, no smoking laws, and restricting youth access all reduce the number of cigarettes smoked by men, but not by women. For women, smoking is seen as a coping strategy for low income and stress, although economic and legal pressures not to smoke are efficient in men. Some strategies of smoking cessation could be the exercise. The exercise reduces craving, especially in the presence of other stressors, but show no effect on the ad libitum smoking. Physical activation significantly reduces snacking and attenuation via to both smoking and snacking environmental costs. A combined approach targeted at overall health improvement, including the NSP and moderate to vigorous exercise, might be beneficial. So here we have some treatments of cigarette smoking. You have the fearing, getting sick, feeling in control, proving the quitting is possible, stopping others from nagging, being forced by others to quit, saving money. They relapse due to withdrawal symptoms, stress and frustration, social pressure, alcohol use, and weight gain. The number one treatment goal is to have the patient stop smoking. So education, counseling, support groups, and medication might be used. Moreover, prevention is the most important, and not starting to smoke is much easier than helping a person to quit smoking. Another way of treatment would be the pulmonary rehabilitation programs, which involve primarily two components, education as well as exercise. Patient education includes a variety of techniques such as proper breathing techniques, clearance of secretion, understanding their medication and devices, efficient body mechanism, and networking with other lung patients. So that being said, as conclusions, we can say that between 40 to 45% of all deaths due to cancer is nicotine related. As a consequence, the biopsychosocial model that includes demographic factors like gender, culture, or age is best that contemporary clinical psychology has to offer to help smokers to quit. So to use the biopsychosocial model means to satisfy the multi-causal, the multifactorial, and the multidimensional aspects of human health related to behavior like smoking. To neglect one of those biopsychosocial factors would mean to miss the opportunity to most effectively treat an individual who smokes.